Welcome. This module is designed to cover the ethics and limitations of the Genetic Information Non-Discrimination Act and cover its role in a genetic counseling session.
The Genetic Information Non-Discrimination Act is also known as GINA. It was signed into federal law by President George W. Bush back in 2008. Essentially, this prevents discrimination based on genetic information in healthcare and in employment. This means that companies can't make employment-related decisions like hiring or firing someone based on their genetic results. It also prevents health insurance companies from changing someone's benefits, coverage, cost, or eligibility based on someone's genetic information. Outside of health and employment, GINA also protects people whose genetic information is used in research. Many research studies rely on people being willing to share their genetic information, and GINA helps to keep this private. This means that people can volunteer for studies without having to worry about their genetic results making their way to their employer or their health insurance and having consequences.
GINA was enacted to preemptively prevent discrimination in insurance and employment at a time when genetic testing was starting to dramatically increase. At that time, the U.S. Congress hoped to reduce public fear about genetic discrimination that discouraged people from undergoing medically actionable testing and participating in research. This was a period of time prior to the end of insurers denying coverage or charging higher premiums for so-called pre-existing conditions, which were banned with the passage of the Affordable Care Act in 2014. Therefore, while it is not known how much genetic discrimination occurred prior to GINA, the law was passed to alleviate public concern.
As much as GINA has helped to protect patients, it definitely is not perfect. Not all forms of genetic discrimination are prevented under the law. For instance, anyone who works for a company with 15 or fewer employees is not protected under GINA. If someone wants to sign up for a new life insurance or a short or long-term disability insurance policy, they could potentially be denied or offered less coverage than they would like based on their genetic information. If someone already has these insurance policies in place, and then later on they find out they have a genetic predisposition to a condition, they cannot be dropped from their policies. This potential discrimination could only happen if a person has already had genetic testing done and is trying to sign up for a new policy or increase their coverage. In regards to somebody who already has been diagnosed with a condition, GINA can get a little murky. Let's say, as an example, someone finds out they have a change in a gene that puts them at a higher risk of developing breast cancer, but they've never had cancer. GINA would protect this person. Let's say someone else finds out they have the same gene change, but they currently have breast cancer. This cancer would be considered a pre-existing condition, and as far as health insurance goes, this person wouldn't be protected under GINA. However, we have the Affordable Care Act, which does prevent people with pre-existing conditions from being denied or being dropped from their health insurance. So even though GINA may not cover these individuals, there are other measures in place to protect them. Other people who are not protected under GINA include people in the U.S. military, or those who use the Veterans Administration, the Indian Health Services, or the Federal Employees Health Benefits Program for healthcare. While these people aren't protected under GINA, there are other laws in place that give them similar protections so they're not left with nothing. Now, we've been talking about healthcare and employment, and that's because GINA does not extend outside of those areas. That doesn't mean genetic discrimination doesn't happen in other fields, though. As one example, let's take a look at a case of genetic discrimination at a school. This happened in 2012, 4 years after GINA was made a law. While enrolling her son Coleman in middle school, a mother disclosed on his health forms that he had genetic markers for cystic fibrosis, which is a genetic condition that can affect someone's lungs. It's important to know that we all have 2 copies of each gene, and to have cystic fibrosis, someone needs these genetic markers on both copies of a certain gene. Coleman had markers on 1 copy, so he did not have cystic fibrosis. It's also important to know that people with cystic fibrosis are more likely to spread germs to other people with the condition, which can make them very sick, and it's recommended that classrooms do not have more than one child with cystic fibrosis in them. This middle school already had 2 children with the condition, and without the permission of Coleman's parents, a teacher told these other parents that Coleman had cystic fibrosis, which was not true. These parents demanded that Coleman be transferred to a different middle school out of concern for the health of their children, and Coleman was removed from his school in front of his class. His parents did not consent to this and sued the school, which led to Coleman being allowed to return. A year later, the family filed another suit claiming that the school violated the Americans with Disabilities Act, or the ADA, saying that Coleman was discriminated against due to a perceived disability. But the school argued that they thought he was a risk to other students, and that's why they did what they did. This case was at first dismissed, but after a few years of legal battles, the school did end up paying out a settlement to the family. You'll notice that I didn't mention GINA, and that's because GINA doesn't extend beyond healthcare and employment, which meant that there was no law to cover this type of genetic discrimination, which is why this family tried to make a case under the ADA. Now, this case raises some interesting questions to think about. If GINA had applied to the classroom, would the lawsuit have been over much sooner, and would the school have faced a harsher punishment? If Coleman actually had cystic fibrosis, would the school have been justified in telling the other parents about this, and would they have been justified in having Coleman transfer? And would it make sense to update GINA in order to cover these areas? There's a lot of angles to consider here, and these situations can be tricky to think about.
Let's consider another case. This one is hypothetical. Please feel welcome to follow along with the case by clicking on the hyperlink on the screen. Jim Sanders is a small business owner. He owns a bakery in the corner of town. The bakery currently has 10 employees. Jim is interested in hiring one more employee, a web content editor, who can help launch the bakery's transition to an online medium. 2 candidates apply for the position, and both are highly qualified, with similar work experience and skills. Even after Jim has interviewed both candidates, he isn't sure which one he will hire. However, he learns soon after, through a Facebook post, that candidate number 1 has a genetic risk for multiple sclerosis, MS. The candidate is healthy as of now, but it is possible that the disease will manifest in the future. Jim and his wife Sandra have 3 children who are in high school and will be attending college soon. Jim knows that he will not be able to afford his children's education and the potential increase in insurance premiums and/or increased sick days should candidate number 1 develop the disease. Jim decides that he is not willing to take the chance, and he ends up hiring candidate number 2, who is not genetically predisposed to any disease. Because his business is small, with only 10 employees, the Federal Genetic Information Non-Discrimination Act does not apply to him, and he is not breaking any laws. Now ask yourself, if you were Jim, would you have hired candidate number 2 also? Currently, 62% of respondents feel that no. In this case, genetics are not a guarantee, and the disease may never manifest. Deciding against hiring someone who is with a genetic predisposition is discriminatory, even if it is not illegal. However, 38% of respondents currently feel that yes, Jim's primary responsibility is to his family. His financial concerns are too important in this case to hire the candidate who may be diagnosed with MS in the future. This case highlights some of the ethical dilemmas that arise for entities not covered by the Genetic Information Non-Discrimination Act. Now let's consider how GINA can be relevant to genetic counseling. To assess the impact of GINA on a genetic counseling session, let's consider 2 examples where the law might be discussed in a clinical setting. The Genetic Information Non-Discrimination Act comes up frequently when counseling healthy adults who are considering predictive genetic screening for adult-onset conditions. This is a relatively common type of referral when there is a family history of disease. Put yourself in the shoes of a cancer genetic counselor. A 32-year-old woman with 3 young children presents to our cancer clinic due to a family history of hereditary breast and ovarian cancer syndrome, attributed to a high penetrance familial mutation in the BRCA1 gene. It is important to understand for this scenario that this type of mutation may confer up to an 80% lifetime risk of developing breast cancer and also increases risk for other types of cancer. This patient may be eager to pursue genetic testing after having lost a sister, a mother, or an aunt to breast or ovarian cancer. Our job is to counsel this patient about the protections offered by GINA when we are consenting her to pursue testing. And during this discussion, we should ask her if she is happy with her current life, long-term, and disability insurance. These are types of insurances that some individuals opt to purchase through their employer, so she may or may not have already considered these types of insurance. This patient may wish to take out a life or long-term disability insurance policy prior to pursuing testing. Because these types of insurance are not covered by GINA, if our patient receives a positive result for a pathogenic variant in BRCA1 prior to taking out life, long-term, or disability coverage, she may be subject to denial of service or very high premium rates. So it may be in her interest to make sure she is happy with her coverage prior to moving forward with testing. After discussing if the patient is happy with her current life, long-term, and disability coverage, she may decide to wait to test until reviewing her policy, or she may be happy with her coverage and decide to proceed. In another example, our patient may work for a small business with fewer than 15 employees. Our job is to explain that GINA does not protect him against employment decisions due to his company size. However, we can also tell him that his company would likely not have access to his genetic testing results because these are protected health information and are therefore protected by the HIPAA law.
If you'd like to learn more about anything we discussed here, here are some websites you can check out.
Thank you for your interest in this module about the Genetic Information Non-Discrimination Act. If you want to learn more, please check out our additional modules. This series was produced by the Long Island University Genetic Counseling Program, Class of 2023. Special thanks goes to our Program Director, Monica Zach-Goals, and Dr. Heather Butts.